This is about people and technology equaling better health. Technology, as we've talked about, alone does not solve problems. Patients, families, staff find it hard to navigate and communicate across the health system. So how can existing technology assist people, provide education, improve health literacy, and help people become the leading partner in their own health? We're going to hear first from Dr. Nick Woods, Health Industry Executive at Microsoft Australia, 25 years experience in clinical medicine and digital health globally. His role at Microsoft is to grow an ecosystem of partners across healthcare and improve healthcare using new technologies such as AI and the Internet of Things. Then we'll hear from Adjunct Associate Professor Cheryl McCulloch, the Director of Clinical Integration at the Sydney Children's Hospital Network. She has 25 years health experience in nursing research, education and management. Her responsibilities include clinical leadership for e-health strategy and adoption, clinical analytics and revenue sustainability, and is also on the Clinical and Technical Advisory Committee to the Australian Digital Health Agency. But first, please welcome from Microsoft, Nick Woods.
Thank you. Well, as Cheryl and I sort of contemplated what we were going to talk about today and come up with a fancy title, we came up with this: People and Technology and Better Health, ? So as we posed ourselves that question, I firmly believe that with people and technology we can achieve better health.
I think in the back of each of our minds we were planning a little funeral. And just didn't know where it would go after he was born. Winston was diagnosed with HLHS, which is hypoplastic left heart syndrome.
1 in 100 to about 125 babies are born with heart disease every year. And out of those, about 1% are born with half a heart. Out of all the heart surgery we do, this is the most high risk.
They lose about 25% of these babies in between the two surgeries.
The standard of care at the time was to send these families home with a weighing scale and a pulse oximeter and a 3-ring binder, and they were asked to record measurements of their baby every day.
There would have been a lot to juggle and learn on our end, just as new parents. And then we added all these things in that really increased the stress level.
So we needed a method that we could actually send something home with the parents so that we could better monitor and be alerted if there were conditions that we were concerned about with the patient. We have a Microsoft Surface that we load our software on. We call it CHAMP. We decided we wanted to use a modern app with Windows 10 as the operating system.
We would log all of his vitals, and that app became this seamless piece to his care.
With the daily reports that come in from the Azure cloud, if anything is an outlier that needs to be notified to us immediately, it'll alert us.
The tablet already has a camera, and we said, why not get video every day in addition to all the other measurements, and just see what that does?
One of the things that saved Winston's life was the 15-second video.
When we were looking at his information, he had a couple days of not gaining weight. He was breathing a little bit harder, and he just wasn't happy on his video.
They could pull it from when he was doing fine and saying, okay, a couple weeks ago, this is what he looked like. Now he looks like this. We think it is part of his aorta.
They did the procedure the next day, and then I think he went home the day after.
There's still that underlying piece on the back of your mind. You're going, this is major heart surgery.
I mean, it's a scary thing to think of what could have happened.
This technology literally saved his life.
So as we think about the technology part of that story, it was actually quite a simple, relatively straightforward collection of technologies, but the impact on the people has been significant. In the CHAMP program, which is out of Kansas City Children's Mercy, has got a 0% mortality over 18 months. So it's been a fantastic program supported by that technology. So if we sort of think towards the newer future, what's driving the engagement between patients, carers, their families, and consumers. And we know that we're digitising ourselves as a society. We know that there are big programs of work going on in New South Wales for EMRs and medication management, etc. So we really are creating those digital foundations, and that creates new opportunities for our patients and consumers to engage with that information. And if we're going to try and get the best out of things like patient-reported outcome measures, then we're starting to get to that time where we can bring all of this together. And the other part that excites me a lot is from a technology perspective. We're seeing these incredible technologies coming out now. We already do, voice-to-voice translation for 9 languages real time. So I can talk in Mandarin, and it can be translated into Spanish in real time. And we've also seen this morning, a big theme around mixed reality and immersive realities. And I'll invite you to have a look at YouTube. There's some great work being done by Silverchain out of Perth and WA, using the HoloLens to bring GPs real time as a holographic image into a community nursing consultation as well. So I think we're at a really exciting time, and I guess for me, it's more posing the question about how do we best innovate around people and technology to get best health outcomes. So before I hand over to Cheryl, I just wanted to say on behalf of Microsoft, thank you for all the great work you do. And I know that's a theme that's come out a lot, but it is an incredible job you do, relentless compassion and commitment. So thank you. Cheryl.
Thanks, Nick. So I'm Cheryl, I'm from Sydney Children's Hospitals Network, and I was asked to come and share a little bit of our journey with you and how we're using technology to connect with patients. We've been working on digital integration of our health services for more than 20 years, and really that's been very focused on what happens internally in our hospitals. And we recognised in the last 5 years or so that we really need to find a way to connect with patients who aren't in hospital, because that's where they are most of the time. And many of our patients are not local to us, so they come from all over Australia and some other parts of the world, and we need to talk to them wherever they are during the course of their life, and then we need to hand them over to the care of adult providers as they move into their adulthood. So this is a little bit of how we're going to tackle some of that. We went to market to see if anybody was actually doing this and helping patients connect pieces of information across so many providers, and there wasn't someone that could do that for us at that time. But there were people who were willing to work with us to co-design what we wanted. We knew that we couldn't integrate with every medical system out there. We couldn't work with every GP and every hospital and every practice across Australia. So we had to find a way to make the patient the conduit for all of that information. So OneView was very successful in approaching us and saying that they could commit to working with us and providing a way for patients to share their information with others. So we worked internally first, really to set up the hospital system so that they could talk to their teams while they were in our care. And then during that period, and we've had that live for about a year now, we've had some great results in terms of looking at the patient experience, and that's improved by about 20% since we introduced OneView into the bedside. And then in that time, we've been working on development of the mobile application, which is really connecting patients while they're not with us. So it's the same sort of tool, but the information flows from the inside of the hospital to the outside of the hospital. So we've introduced some basic things like how to register yourself, how many proxies you might have. Proxies can be parents, but they could also be siblings, they can be carers, they could be another doctor, or perhaps your school teacher, depending on what your needs are. It also allows your appointments to come through and come into your native calendar, clinician-patient communication, and an SMS-type communication that then comes back into the medical record. We push education through the applications, and we allow support to connect with others through Skype and social media. And there's a place in there for patients to start recording their own information so that they're collecting their narrative of their healthcare journey. It's pretty simple. It works like every other app. We don't really have to train people how to use it, and pretty much they open it, and once they're in it, they're off. It's very, very simple. And we have a future plan where we'll include things like wearables and patient-reported measures at home. But basically, we can send the appointment, they can bring it into the native calendar, we give them instructions, we make sure they're ready for their appointment so they're doing all the right things to prep, but they also then get SMS push reminders, so they get pinged a couple of days before and then just before the appointment, make sure they turn up on time. We also have Cerner as our EMR. We wanted to make sure clinicians were really only having to work in one place. So Cerner is the basis for the clinicians, and My Health Memory, the app that OneView's helped us develop, is really the place for the families. But they cross over, and where they cross over is a communication place which allows those messages that patients and families are having during the time outside of hospital to come back into the record for us to see. So it means that from a medico-legal perspective, when we're changing the plan of care, we have a record of that. We can also actually recognise that as activity in terms of we're changing treatment plan, we're intervening here. And we can make sure that patients and families have a record of those communication and care plan changes because it's in their phone. So they've got that history as well. It's been pretty popular. We have about 60% uptake in the pilot groups. We've only been running it for 3 months, and we have about 300 patients registered, and we're just bringing on another 200 in this month. If all that goes well, we're going to go live with the rest of the hospital in the next couple of months, but we're also adding quite a few other pieces, and we're asking the University of Sydney to help us evaluate this. So they're working with us to really check in and make sure that patients and families are happy to use it, that clinicians are finding that it's efficient, and also what's the theme, the content of the information that we're actually getting out of these patient communications, and does it change health outcomes? This is our first family that signed up. They're really happy. They've got 2 kids with CF, and it really makes managing their care a lot easier. And they just said, why did it take you so long? So it's really, we're lucky we've got a cohort of patients and families who are really technologically savvy. 97% of them come into the clinic with a mobile device. They have it with them all the time, so we know we can get in touch with them when we need to. Some of the things that we're bringing along soon will hopefully help us both inside the hospital and outside the hospital to create some efficiencies. We're really hoping that the Australian Commission will help us with some paediatric focused patient-reported experience and outcome measures, so we've started connecting with them. We want to make sure that we're working from the pre-admission space, well, really from referral right through to all of the other treatment options in their home and other provider situations. And we've created a shared care summary in the Cerner space, which is compartmentalised and can be annotated by patients back in the OneView application. So really hoping that those sort of connections are going to help us share care in a better way. The aim of this is to make sure that our patients are people first. They get to live where they want to live. They get the care that they need. They're in contact with us when they need to be. But they go on as normal for the rest of the time. We're hoping that we're going to get some new information from those periods between healthcare events that we haven't understood before, and maybe that will help us change our health outcomes or really see why some patients do better than others. We're hoping that the information that's connected in the application will actually be used as sort of intelligence data to keep winding up what we do next. We'll be able to connect with patients wherever they are across Australia and around the world, but also this could create an efficiency for healthcare, reducing duplication, empowering patients to make better provider decisions, hopefully making decisions that are really intelligent because they will have improved their health understanding, their health literacy. There'll be transparent communication between their providers, and hopefully better lifelong health outcomes and a record for life, which is really what we want to set the next generation up for. So I just want to say thank you. I've really appreciated being able to come here and share that little piece of the story with you, and it is just a piece and we've got a long way to go. Thank you very much to our partners OneView, who have taken an enormous amount of patience to work with us and with our families and with our partners and with the university to make sure that we get this right. And also for our other vendors, Microsoft, Cerner, everybody else who's helped us along the way. And great support from my executive. I'm not sure if Mark was here, but you rule. Thanks.